Medical gaslighting is something that Hello Alpha is particularly concerned about when it comes to hormone related issues and weight management. What is that?
Medical gaslighting is when a patient feels that their healthcare provider is not really listening to what they're saying, or maybe that their symptoms are minimized, or potentially all made up, it's in their head. One thing that we prioritize here at Hello Alpha is ensuring that patients are heard. I would encourage you to not think that a particular symptom you're experiencing or what you're going through is just natural. There's lots of things that occur naturally that we have proven treatments for.
Hi, and welcome to the BODi Experience podcast. This is a very exciting and maybe a little different twist on what we do with the podcast. Normally, we're talking about the results that people will get, and we're talking about the content that we're developing and giving you insights into what the BODi Experience really is about. Well, now we've expanded the BODi Experience, meaning we've got a new partnership that I wanted to talk about and get into women's health issues a little bit. Obviously, that's pertinent to our launch of Autumn Calabrese's Belvatel program, but we're going to go a little bit deeper into something that I've learned that is helping people, get more tailored advice through a virtual medical advisor. The company that we did this partnership with is called Hello Alpha, and I'm about to bring on the chief medical officer. Hello Alpha is a leading virtual healthcare company. And what they do is they provide virtual healthcare that's tailored to the needs of a patient, particularly for over 100 different conditions. It includes women's health, hormone health, weight loss, primary care, and patients connect with a board certified medical provider. They do it virtually, so you don't have to do a doctor visit. You can get at home testing, personalized treatment plans, and ongoing support. So you can imagine this is a real big deal for BODi to step out of its normal pure content and supplement approach to helping you achieve your goals and lead a healthy, fulfilling life. And now collaborating with a company like Hello Alpha to expand how we support the true and comprehensive health and wellness of our customers and members. So we're going to talk a little bit about why Hello Alpha even exists and what it could provide you as a prospective patient of the Hello Alpha providers and a BODi subscriber, how this might enhance your overall experience. But let me introduce the Chief Medical Officer of Hello Alpha, Loni Belyea, to help me navigate through this. Good afternoon, Dr. Belyea. How are you?
I'm doing well, Carl. Thank you so much for having me on this podcast. We here at Hello Alpha are super excited about our partnership with BODi, and I'm happy to be here with you today answering some very important questions.
Well, we've been hearing a lot recently about this idea of telehealth. I mean, just about every company that can put together a group of doctors to take phone calls is launching a telehealth organization and service, and it's usually around the idea of getting, I think, easier access to pharmaceuticals or weight loss medications like GLP-1s. But Hello Alpha was created to solve a more acute problem. I think that particularly for women. So that's where I want to start. How is Hello Alpha different? Why did we need another telehealth provider, and how is Hello Alpha distinct in this new form of providing healthcare?
Carl, that is an excellent question. At Hello Alpha, we don't just focus on singular common ailments, many of which you've highlighted: erectile dysfunction, hair loss, weight loss, eyelash issues. We take a truly holistic approach to care, and we focus on relationship building, providing whole person care, providing comprehensive primary care, and doing it in a way that's convenient for patients. So we don't take care of just single conditions. We take care of over 100 plus conditions, including those mentioned above, but also things like depression, anxiety, diabetes, thyroid issues, cholesterol. Because what we know is most conditions don't exist in a silo. And by not providing comprehensive treatment, really understanding what the patient is going through, we're doing them a disservice.
So why do you think, I mean, everything that you listed is what I would expect to learn, or the kind of care I would expect from primary care physician. But I also know that in many cases, women are frustrated, in particular with the, I think everybody is always shocked at sort of how quickly they're shuffled in and shuffled out of a doctor's office. Um, so how is this filling a gap that perhaps something that we're not getting from the relationship with our current primary care physician?
Yeah, so you hit the nail on the head again, Carl. Currently, in the way we deliver healthcare, principally in the United States, is patients go into a brick and mortar facility. They have, on average, between 5 and 7 minutes with their healthcare provider, which is just enough time to get your vitals done and settle in. And so often, women have found that these conversations around their hormone health or what's particularly bothering them gets lost in the shuffle. They don't have enough time to really, number one, develop that relationship with their healthcare provider, and two, to have a conversation, a thorough conversation about what is going on. Also, many women feel that their concerns are dismissed. Right? They go in, they've got a lot of things they want to talk about, but their healthcare provider really only has time to talk about one or two. And so instead of focusing on some sleep issues, mental health, mood, hormones, the conversation is really all about preventative maintenance and maybe one or two chronic conditions. And so we found that a lot of women, and actually all individuals, right? Not just those assigned female at birth, but there's many folks in the US who feel like their questions, their concerns aren't heard and answered. And so the way we solve that at Hello Alpha is by ensuring that our patients have the space and time to accurately highlight what's affecting them, and our providers take time with their patients as well.
I guess, I guess it's sort of interesting, and this is where we've the sort of the insurance culture that we've evolved into with your primary care physician has led to this requirement that things move so fast at a doctor's office, because they're not it, it's not this profession that is both as lucrative or as patient focused as it used to be. It's a lot of logistics, and has sort of steered toward dealing with acute issues rather than health, and helping somebody explore what they might be experiencing. I'm always blown away. And if there was anything to be critical of in the healthcare profession, like, I never understand why you walk into an office and you fill in this chart and it asks you, what are your issues? What are you feeling? What's happening? Da da da. You hand the chart in. Then they take you to a room and you wait 5 or 10 minutes or 20 minutes, some cases. The nurse comes in. She goes, tell me what's going on. She fills in another chart. And then you go to another room, you wait another 20 minutes, and the doctor comes in and says, what's going on? And you're like, I just told, I filled in a chart. I told the nurse, what is the deal here? Do people talk? And so I suppose now with um, a way to do this virtually, the cost structure is radically changed and the convenience is radically improved. So a person has the ability to investigate questions that they have with a doctor who has been specifically trained to answer these questions and understands that that's what the job is, that this is not a let me get you an antibiotic and get you out of here profession now. This is truly telehealth. And I don't think I think we need to double click into that. In fact, you mentioned on a phone call that we had that you have a specific curriculum that you teach your practitioners. And we didn't go into it, but that sort of, after we hung up, I was like, oh, I wonder what that was. Can you go into what is the need for a specific curriculum? Because, any of us thinking about medical school would be like, well, I'm hoping that my doctor knows it all. So why does he need or she need a specific curriculum?
Yeah, you make so many good points, Carl. So what we have found here at Hello Alpha is that many providers have not been specifically trained in how to provide whole person comprehensive care and how to build those relationships with patients. There is data to support that relationships in themselves, right? The relationship you have with your healthcare provider, your doctor, can in themselves be therapeutic. And so we've created a curriculum here at Hello Alpha, which all providers go through. It's about how to build those relationships with patients. And it's a little different because we provide mostly asynchronous healthcare. And so we found that our providers, you don't get a lot of training on how to deliver care asynchronously in medical school or in residency training. And so we've had to teach our providers how to build those connections via mostly asynchronous platform.
What's asynchronous mean? I don't even understand that word.
Oh, yeah. Okay, great. Yes. So asynchronous is really communication that does not occur at the same time. So most of the care we provide, our providers are not face to face with an individual at that given point in time. And so our patients complete what we call dynamic intakes. And so these are questionnaires that are designed to replicate a standard, what we call history that we would receive from patients. They're dynamic in the sense that no two patients have the exact same intake process. And there's been a lot of thought that has gone into these questionnaires to make sure appropriate branch points are addressed, but also so that, if a patient spends too long on one particular question or answers it a particular way, there are branch points so that we collect more information and we acknowledge that might be a point of deeper investigation for the providers.
You mentioned in our call that it was some crazy statistic about how little education a doctor might get or a medical student might get on specific women's issues. Can you take me back to that? What was that statistic?
Yes. Oh gosh, the data has changed, but what we know is less than 50% of medical schools have a dedicated women's health curriculum. And so let me talk a little bit about definitions, Carl. When I specifically refer to women's health, I'm specifically referring to healthcare encompassing all aspects of health and wellness specific to women. And so many medical students and healthcare providers, they get great educational foundational education on primary care. And also there is a whole medical specialty of OBGYN, but that's really focused on predominantly the female reproductive system, pregnancy and childbirth. And so really women's health encompasses kind of the intersection of primary care and OBGYN. And there's not a whole lot of training that most providers get regarding that intersectional education.
I see. Well, I do find it interesting that I think the medicine in general, Western medicine, tends to isolate everything. So I've got this one symptom. Let me treat that one symptom. And the usually, unless you have a really special doctor, they're not thinking about what's the consequence to all my other systems. Um, and so holistic care is a big deal. But when I think about this process, and I'm still trying to get my head around trusting telehealth, because I would sort of expect the doctor tap on things to get my reflexes and listen to my lungs. And so I'm wondering, and I assume that you're still advocating that in-person visits can be valuable to a person. So how can the telehealth provider be as effective or differently effective as seeing a doctor in person?
Yeah, that's a great question, Carl. We encounter this question frequently. So I want you to take a second to think about the last few times you went to your doctor's office. And I bet if you really think about it, less than 50% of those visits, they actually performed a physical exam that required touching you. Okay. And so what we know is that a lot of conditions require physical touch, but there is a subset of conditions that really require just a clinical diagnosis, right? And so, what we've done at Hello Alpha is we got really concrete. We know our limitations as a telehealth company. And so, for instance, let's say you're completing our dynamic intake process based on your responses to particular questions. At the end of that visit, we may ask you to schedule a synchronous visit. And that means either a phone call or a video visit. Because we know, based on the history that you've provided us, we likely are going to have several follow up questions, and maybe it's best just to hop on the phone, or we really need a video visit. And so we're very concrete about what can take place completely asynchronously and what requires either a more in depth conversation or a video visit. And to that point, we also know our limitations with regards to when an in-person physical exam is necessary, and we refer patients out, and we're very clear about that. Um, a lot of patients do have in-person providers, but they just can't get in to see them frequently, or they feel, like they don't have enough time to really get answers to their questions. And for those patients who don't have a regular in-person provider, we do have our care coordinators help them establish an in-person PCP, or, a particular visit for an acute symptom.
What's a PCP?
Primary care provider.
Okay, got it. You got to keep up with the acronyms. Um, and for anybody who is listening, we'll put links in the show notes or information on how to access Hello Alpha if you want to investigate this through the relationship that we have with them at BODi. And in fact, that's I suppose let's get more specific to our relationship. Obviously, for 25 years, for over 25 years, we've been promoting fitness and nutrition as really the most proven prescription for health, or certainly the foundation for an approach to well-being and longevity, that should almost come before any medical intervention. So my question is, does a medical model like Hello Alpha complement that premise of the foundation of overall well-being? Because I know even my doctor, you know, there's always I can always tell there's this program running in the back of his head that is, do I need to prescribe something? Do I need to prescribe something? Like whether it's cholesterol, blood pressure, whatever. I'm getting old, 61 years old. So it's shingles and vaccinations. And like when I want him to be thinking holistically about my well being and what my lifestyle needs to be, let's double click into that before we start to treat things. So anyway, I don't want to get off on a tangent, but how does the BODi Hello Alpha relationship of business model work and fit together?
Well, what we know is that exercise is medicine. Exercise, in and of itself, is oftentimes therapeutic. And so you're right. As healthcare providers, we have to calm down our instinct to reflexively prescribe a pharmaceutical when often the easiest and most simple treatment can be to exercise and to receive or, nourish your body with a healthy diet. And so at our core at Hello Alpha, we provide primary care from experts in women's health. And so one of the core tenets of our philosophy is ensuring that patients receive what we call preventative care. And part of that is exercise, Carl. We know that, just for cardiovascular purposes, and again, right, cardiovascular disease is the number one cause of death. But for cardiovascular purposes, people should be engaging in a minimum 150 minutes of exercise a week. So that's 2.5 hours, right? That's a combination of cardio and strength training. And we also know the benefits of eating a nutritious diet that emphasizes whole, unprocessed foods as well. And so partnering with BODi gives our patients more easy access to tools in their toolkit to achieve optimal health.
So I want to get into the relationship of to women's hormone health in a second. But first, you said cardiovascular disease is the number one cause of death. So cardiovascular disease, what is, like, just to try to visualize what's going on in the body, if you can. I don't know. I'm sure it's more complex than I'm trying to get in 20 seconds. But what's going on in the body that equates to cardiovascular disease?
Yeah. So when we think about, to keep it simple, things that can cause immediate death, right? Because we know things like high cholesterol, high blood pressure, are what we call silent killers. Sometimes you can have uncontrolled cholesterol and high blood pressure for years and have no symptoms and you feel very well. But ultimately, the consequence could be a large, massive heart attack. And that's where one of the blood vessels in the heart gets clogged. And so you're not able to perfuse the rest of your body. And similarly with a stroke, right? If you have the blood supply to your brain cut off, it could damage structures in the brain that's necessary to sustain life and necessary to function.
So basically, cardiovascular means there's some issue with distributing blood and thus oxygen to the body, whether it's constriction of the blood vessels, like hypertension that might happen, or narrowing of the blood flow, which can happen with the buildup of what they call, I guess, cholesterol or plaque
Plaque, yeah.
within the cardiovascular system. So those things are basically, it's the distribution of blood and thereby oxygen that is threatened with ongoing lack of care to the cardiovascular system. So stress can contribute to that. Diet obviously contributes to that. Heart health, the ability for the heart to respond to stress and pump, whether it's deteriorates to walking up or down steps. Am I sort of in the right zone here on this?
You are, Carl. You are
Okay.
exactly right where you need to be. And, it's really important because you talked about earlier in our call, there are a lot of telehealth companies who are treating conditions in isolation and, can be seen as pill mills. And so when you think about something as common as erectile dysfunction, right? Generally, folks don't just get erectile dysfunction out of the blue. Those patients should have a comprehensive assessment of their cardiovascular disease. And so, plaque buildup in arteries and decreased blood flow is the number one cause for erectile dysfunction, for instance.
Yeah. Got it. So, well, I think that's helpful for people because it can be such an abstract. In the medical community, obviously, cardiovascular disease instantly has connotation, but as the number one cause of death, I think it's important for people like me, people who aren't steeped in the terminology, to understand what are the simple things that are contributing to the number one cause of death, such as strength of heart. Because, like, it's interesting because there's so much discussion about you need to lift weights, and cardio is sometimes even vilified because people tend to think cardio and weight loss, right? So then the counter argument is, well, build your metabolism, build your muscle. But cardio is also life, like that ability to handle stress or to navigate an increase in intensity of whatever activity is going on is an important thing, especially as we age. My point is, I think it's helpful for people to understand what are the what are the things that contribute to this broad bucket of a thing called cardiovascular disease. So that was super helpful. Now, I mentioned that stress can be a contributor to cardiovascular disease. Obviously, certainly stress and high sodium can contribute to high blood pressure. Um, those particularly stress can contribute to the flattening of the cortisol curve and the cortisol response. And now we get into hormone health, which can be particularly acute for women, just because the hormonal system, the endocrine system for women is that there's so many levers that affect everything. And one of the things that you and the Hello Alpha team seemed especially excited about with our relationship was our launch of Belvatel. Why do you think that that program in specific is so relevant to the Hello Alpha mission of serving female patients?
Yes. So here at Hello Alpha, we are always super excited to learn about programs that are designed for women struggling with hormone issues. And as you've nailed it, Carl, the woman's body has unique hormonal needs and imbalances are real, right? And so, if you're lucky enough to get to a certain age, you will have gone through perimenopause and menopause. And so, we're really excited about Belvatel because it's a program that complements our medical advice to a T, right? And so by combining nutrition, exercise, mindfulness, ways to decrease your stress, we know those are tools that should be utilized more frequently to encourage folks to live productive and more healthy lives. So we're really excited to partner with you, not just with BODi, but also with the Belvatel program as well.
Yeah. So, one thing that I think we hear, or the reaction that I get when we talk about hormonal imbalances for women, is it seems to be immediately synonymous with the perimenopausal phase. But I don't think that's the case, is it?
No, it's not. So listen, the body produces over 50 hormones, right? And so when we talk about hormone imbalance, it could be an imbalance of any of the body's natural hormones, right? And so when we think about common hormones, Carl, think about insulin, for instance. We know that disruption of insulin, which is a hormone, can lead to things like diabetes. We have thyroid stimulating hormone, which signals the body to release more thyroid hormone. That can be implicated in things like hypo or hyperthyroidism, which is key to metabolism. And so we use the term hormone imbalance very loosely with respect to women to really focus on the perimenopause, menopause transition. But really, there are so many hormones in the body that deserve attention. And so often we have women coming to us suffering from things like hot flashes, right? And it's really easy to say, well, you're of a certain age and a certain demographic. And so we think this is due to perimenopause. But there are so many other things, including other hormone imbalances, that could lead to those same symptoms. So, for instance, thyroid issues can lead to hot flashes. Taking a holistic approach, medications can lead to hot flashes. And really important that when we say hormone imbalance, we get really specific about which hormones imbalance could lead to the specific symptoms an individual is facing, and not put women in sort of the perimenopause menopausal box that you have these symptoms, this is the cause. Oftentimes, the etiology is what we call multifactorial. The symptoms are due to the interplay of lots of hormones and other medical conditions.
How does a woman know if their they're going through something that this is just what women go through. I just need to deal with it and muscle through it, which is, I think, unfortunately, some of the advice that they'll get from doctors who aren't particularly trained in this area. How do they know if it's something just deal with it, that's life, or it's something that actually a doctor's advice might help them get some relief?
Well, to all the women who are watching this podcast, I would encourage you to not think that a particular symptom you're experiencing or what you're going through is just natural, right? And this is why it's really important to have good relationships with your healthcare providers. A relationship in which you feel comfortable explaining what's going on. And listen, it may be natural, right? Perimenopause is a natural transition into menopause. But there's lots of things that occur naturally that we have proven treatments for. And so I would say you've got to have a conversation with your healthcare provider about what you're experiencing. And, a lot of women talk to their friends and like, hey, I'm dealing with this. Oh, I'm dealing with that too. I'd encourage you to make sure you have a proper medical evaluation, because hot flashes in one person may mean one thing, and hot flashes in another person could indicate as a different condition.
Now, you said in our prior conversation, medical gaslighting is something that Hello Alpha is particularly concerned about when it comes to hormone related issues and weight management. What is that? How does Hello Alpha address that?
Yeah, so medical gaslighting is a term that is thrown around when a patient feels that their healthcare provider is not really listening to what they're saying, or maybe that their symptoms are minimized, or potentially all made up, it's in their head. And so, one thing that we prioritize here at Hello Alpha is ensuring that patients are heard, right? And that's how our platform is set up. Our visits can be completed when it's convenient for you in the middle of the night, whether that's 9 p.m., 3 a.m., and there's no time limit, right? So we encourage patients to literally divulge everything that they're experiencing at the moment. And if our providers feel like, they touched upon something but didn't go into great detail, that's when follow up conversations occur. And so it's hard to know whether the symptoms you're going through is, quote unquote natural, but I think you should talk to your healthcare provider to make sure that they understand what's going on and you have a clear etiology and treatment plan.
Now, one of the things that I think you enable is the ability for people to get tests, in-home sort of lab testing, that the office doctor might not even advocate. And it's because of your specific curriculum, your approach to managing chronic conditions, hormone imbalances, and even weight fluctuations. Let's talk a little bit about that, because I know I personally, like, whenever if I get a in-home lab kit, I'm like, well, I can't do this as good as my doctor. Like, these are the things that I'm supposed to have an expert do for me. How do you enable that and make sure that it's effective?
Yeah. So, what we know is that there are a lot of lab tests that can be completed at home in the convenience of your own living room, right? And so, what we found at Hello Alpha is that there were a lot of patients going without labs, right? And labs are diagnostic tools. So, we enable patients to complete several at home labs, whether it's a saliva swab or a urinary test, but also dried blood tests as well. So we found that a lot of patients haven't had labs because it's not convenient for them to go to a brick and mortar facility to get them completed. And we do offer convenient ways for patients to complete labs at home. And so, in particular, for those dealing with hormone imbalance, we have specific labs that we can order and that can be done at home to get to the bottom of specific hormones that may be off, whether it's too high or too low. And then also, we have labs for general primary care purposes, including our patients that we treat for weight loss, diabetes, etc. And so we there's a lot of tests that you still have to go to a brick and mortar facility um, to get, just because they've got to be collected in a very controlled fashion. But there are many general primary care and hormonal labs that can be safely collected at home by you, Carl.
Did you say dry blood test?
Yes. And so the way we collect lab tests at home are a few fashions. The dried blood test involves an individual pricking their finger and putting the blood from a finger prick onto a card, letting it dry, and then mailing it into the
I
lab. So
see.
that's kind of a dried blood
So you're not
test.
drawing your own blood effectively. It's just a little prick.
Yes.
Yeah.
Absolutely not. No one
Yeah.
is, inserting needles into their
Right.
vasculature at home. No, it's just a simple finger prick.
So when we did the testing for Belvatel, we did have a series of fairly sophisticated labs that the test group went through, so we would understand what changed about insulin, their cortisol curve, and other markers. And that's not something that we advocate for everybody, but we wanted to see what would happen. And the changes were quite significant for people. Obviously, everybody in the test group lost weight, but it's how they felt and how that related to their labs, which I think is what impressed our own medical advisors. They were like, "Wow, this thing lifestyle actually really worked the way it was designed into Belvatel." How does a program like Belvatel integrate into the recommendations that your medical practitioners would give to a patient who perhaps has hormone imbalances?
Well, what we know is many hormone imbalance, whether it's thyroid, estrogen, progesterone, etc., can be improved with simple lifestyle changes, including diet, exercise, reducing stress. Stress is huge. And so the Belvatal program is a comprehensive program that addresses all of those things in one program and makes it really easy for our providers to recommend a single solution to addressing all of those components. And so that's what we're really excited about.
Got it. And how do your practitioners, like, are they aware of Belvatal? Do they know about the program? How are they equipped to understand whether Belvatal can be a suitable resource for somebody?
Yes. And so, one thing we do at Hello Alpha is before we engage with the launch date of our partnerships, is we make sure our entire team, this is our clinical team, our healthcare providers, whether they're physicians, nurse practitioners, PAs, dietitians, nurses, etc., they are all trained on the Belvital way. Additionally, our support staff is trained as well. This is important because patients are going to come to us and say, "Hey, I'm doing Belvital, and I'm concerned about X, Y, and Z." And so we want to make sure that our providers know when they say that they've been on the Belvital path, we understand what that path entails, right? What are the steps and components of that? And this is really important because, as you know, Belvital is broken out into several phases, Carl. And so, phase one is a little different than phase two. And so, our healthcare providers have been trained about the components of each individual phase so that we can help patients adhere to the exercise and dietary recommendations. And so that's really important for our team to understand what they're recommending and to be able to field and answer questions that patients may have about the program.
It's so funny. I've been doing this for a quarter of a century and largely felt that it was not our domain to integrate with healthcare per se. I was making fitness videos and trying to get people to eat half the burger and half the fries and two slices of pizza instead of the whole pizza. And I thought, I'm really not equipped to be able to integrate with sophisticated healthcare. But as things have evolved over these 25 years, and now with services like Hello Alpha, I'm pretty excited because what we see is the continuum that people travel down with when they start with BODi. They might not be taking care of themselves at all. They might have, they could be postpartum, they could be just things got away from them, or they never really paid attention. And they have this gateway. And then as they progress, they realize they start to feel better, but they also start to pay closer attention to things that are coming up that are problems that they'd really like to look into. And they realize they have control of their own well-being, which is something that many people, they just don't think they have any control over their well-being unless there's a pill they can take for it. So the fact that we can now introduce people to the foundation of a healthy lifestyle and also then introduce them to the kind of service that Hello Alpha can provide, it's super exciting to me that a person's conscious approach to their own well-being and caring for their well-being can be something that they're not just reactive to, but proactive about. So I'm super excited to bring Hello Alpha into our ecosystem. I'm very excited to introduce BODi and Shakeology and Belvatel and all our workouts to the Hello Alpha ecosystem. So I guess the final question is, how would you advise people who are intrigued by what we've talked about to reach out to Hello Alpha?
Yes, Carl. Thank you so much for that question. And we're so excited about this partnership as well. For those watching, it's super easy to get started with Hello Alpha. And once you register, you'll have access to all of our visits, all of our patient education materials. And we serve patients in all 50 states and DC. You complete our visits on your time when it's convenient for you. And our providers are around 24/7.
Awesome. Well, I really appreciate your time today, Loni, or Dr. Belyea, sorry. But it fascinates me, and I'm excited to participate. I'm excited to help our customers go to the next level of their own care. So like I said, in the show notes here, and if people are watching the video, we'll put links so that you can directly navigate through the BODi ecosystem over to our relationship with Hello Alpha. And I hope at the end of the day, all this is always about helping you achieve your goals and lead a healthy, fulfilling life. And that means being proactive about your own well-being. So on behalf of everybody at BODi and now Hello Alpha, I hope you know that we care about your health. And I hope you take that next step. And if there are things that you have questions about, or you're wondering if your normal is truly normal or needs to be addressed, that you will click through and check out the relationship we have with Hello Alpha. That's it for this edition of the BODi Experience. Thanks so much for tuning in. Please like and subscribe and make sure you're following the podcast. We've got some good stuff coming up. But for now, signing off. Thanks to Hello Alpha. Thanks to Dr. Loni Belyea. And thank you for watching. Take care.
The information in this podcast is for educational purposes only and does not constitute professional medical advice. No patient-provider relationship is formed. Consult a professional healthcare provider in the area for your particular needs before undertaking any new regimen.